Hello friends, today I will be talking about 7 surprising reasons that's hindering your progress with the chronic pain. Not only that, I have a part 2 series where I will be talking about an alternative plan you can follow to get the lasting relief. So before I proceed, let me introduce myself. I am Deepti Patel. I'm a physical therapist, also known as a chronic pain holistic coach and smart functional fitness in the online world. All right, buckle up. This is going to be a long video, but it's so informative, and I hope you listen to all of them and understand why you don't make a progress. One more thing. This is a two-way learning experience. So as much as you're learning from me, I am learning from you. So if you come across any aha moment, please comment below AHA and say what was the insight you get out of this this video. I will highly appreciate it. All right, ready to dive in? Let's go. Ready? Let's get started. Reason number 1. The treatments are usually misguided because of improper diagnosis. Assessment is such an important thing to find out what is the problem, where is the source of the problem is coming from. This is true not only in the medical world, but it's also in the technical and the mechanical world. Once you know what is the problem, you know how to fix it. Unless and until that's where most of the money goes, that let's find out what is the problem, yes? I'm a physical therapist. Let me start with the physical therapy example. If you go to 10 different physical therapists, each one gonna give you a different diagnosis. One might say your one leg is shorter than the other. The other one says, well, your SI joint is out of the back. The fourth one say, well, you have one vertebra is out than the other. The fourth one might say your core is too weak. The fourth gonna say your muscles are too tight. If you have been in physical therapy, you might understand what I'm talking about. But why? I have many times patients will come to me and says, well, I was told my one leg is shorter than the other and I'm wearing this lift in my shoe. And oh my gosh, I won't be able to see any difference in their leg length. And it really intrigues me why, if there is a one leg is shorter than the other, why there is not, when you measure the way, it doesn't seem like it is not. So why there is not a standard of procedure to find out? It should be visible to every single person who measures it that yes, your one leg is shorter than the other or not. Why is it so wishy-washy? Does that make sense? Let me give you another example in orthopedic. Recently, I had a patient who came to me for physical therapy, but he has been in a pain for a long time. He already has 2 lumbar surgery done. He's a 77-year-old man, but he was in so much pain, he asked his physicians to send him to an orthopedic surgeon. He thought surgery is the only way to go. So he goes to his orthopedic surgeon and he says, well, I have to work on fusing your 3 vertebrae with plates and screws. But then at the end, he knew that he will be able to go home same day. He says, what? I'm going to have plates and screws in my back and I'll go home same day? It didn't seem right to him. So he decided I don't want to go here. So he goes to another for second opinion. And this person was well known, and he had some good outcome of his patients and stuff. So he decided to go to him, and he says, "Well, we need to do a surgery. You have so much arthritis and stenosis. Your nerves are getting cramped up, and we need to do a lot of opening in your spine and stuff. And this surgery might take up to 7 to 8 hours. And I don't know if your heart and lungs can take it, but if you're willing to go to this route, we have to run some tests and make sure you are a candidate for surgery." And he said, oh my gosh, I live alone by myself and this seems like a big surgery. I don't know if I'll be able to recover by myself and I don't want to go to a nursing home. So he says no, but then after a few days, one of the friend told him that I know this surgeon and you will really get a good treatment from him. So I highly recommend it. So he goes to this third person for another opinion. Now, this surgeon says, yeah, you don't need a surgery at all. You just need some physical therapy. You need to get your core strong and you need some mobility. And that's how he ended up in my clinic. This another intrigues me, that why is it so wishy-washy? Why some surgeon says you need this kind of a surgery and the one person says you need extensive surgery, and then the other person says you don't need a surgery? Why there is not a clear-cut idea that you need a surgery or you don't need a surgery? It doesn't make sense to me. So don't shoot, most of the time we shoot the darts in the dark rather than just really spend more time in assessing and finding out where the source of the problem is and then try to fix it. Then only the treatment becomes effective. So that's a reason number one. Treatments are misguided because of the improper diagnosis. Reason number two. The majority of the treatments are primarily based on scans. Now, what are the scans? MRIs, CT scans, and so forth. Nowadays, the MRIs and CT scans are so common that most of the people with the back pain or a neck pain or even a knee pain or a shoulder pain, if it's going on for some time, you will most likely that you have an MRI or a CT scan. Now, in my opinion, what happens with the MRI and CT scans, they're good diagnostic tools, okay? But having the MRIs and CT scan done once, you become very laser focused on that particular problem. So for example, you have a low back pain and you get an MRI done, and MRI says you have a disc degenerations, or you have disc herniation, or you have a stenosis, or you have a spondylolisthesis. Now, most of these words, majority of the common people don't understand, right? They break down every single sentence by the letter T and they want to know what exactly wrong with them. And that really feeds the brain in a wrong way. You know, having an MRI and a CT scan done, it's like opening a can of worm. Let me give you my own story. So I think it was about 16, 17 years ago, I had some woman issues. And I had gone through some really hard time, and then I found a new OBGYN, and she said, you know what, let's get an MRI done, find out what is the problem, and then we go from there. So she ordered an MRI, and in those days, the MRIs were not that common, okay? They were usually non-urgent MRIs were done over the weekend. So I remember I went Saturday night and got MRI done. Now, Monday morning, I come to work, and I was really eager to know what's going on. I work in the same medical system, so I could access my own medical record. I know it's illegal, but in my opinion, I don't think it's illegal to look at your own medical record. It's in my opinion. But anyway, and at that time we didn't have any policies that you cannot look at your own medical record. So I opened up my own personal record, and I did not see the radiologist have not read my report yet. So I went through all the images of the MRI myself, and what I found was my L5 and S1 was in a bad shape. I had a disc degeneration there. I had the cartilage were worn out. My one vertebra was slipped down a little bit on top of each other. But you know what? I never had a back pain before that. But 6 months after that, I had a back pain first time, and that lasted for 2 or 3 days. And then after that, I had a recurrent back pain. It will keep coming back every 4 months to 6 months. And being a physical therapist and living with the people with the physical therapy around me, somebody will snap my back, somebody will do the dry needling, I will do mechanical traction on myself and do some core strengthening and keep moving, being an active and stuff. I was able to manage my pain. But again, last 2 years, I had no back pain, no recurrent back pain whatsoever. But anyway, that's a story for another day. But here is going back to an MRI and CT scan again. It's like opening a can of worm. Once you do, most of the time, if you don't know what's going on, you're good to go. But once your mind is fed with what exactly wrong with it, and then you keep feeding that information over and over and over again, it causes more harm. And we forget to look at the bigger picture and just focus on that L4-5 abnormalities and wants to render the treatment just into that area. Many times people will come and ask me, hey, what exercise can I do to put my disc back in place? But you know what? Discs don't cause us pain. Discs are harmless. Don't look at all the disintegrations and disc degenerations and try to fix those. That's not going to take you anywhere. So that's the reason number 2. that your treatments fail because you rendered the treatments depending on your MRIs and CT scan. One more thing I want to tell you here is MRIs and CT scans have their place, okay? I have ordered MRIs myself on some of my patients when that need it. But there are only few and far things you need an MRI for. For example, a fracture or a dislocation. So if you have a very serious injury, a fall or a car accident or something, yes, absolutely. And most of the time, X-ray will tell you if you have anything, any fracture or any dislocations. They can rule that out. And once you have that positive, yes, if you want to look at the deeper picture, how far is the fracture is it it's gonna compress my spinal cord or any major injuries, then MRIs or CT scans are absolutely necessary. The third thing is the cancer. So if you have some classical symptoms of cancer and you go to a primary care doctor and they have any suspicious of the cancer, then absolutely those scans are necessary. The fourth thing is infection. So if you're feeling sick, like a flu kind of a symptoms, you're running a fever or something is going on, yes, those scans are very good to rule out that you don't have any infections in the bones or in the spine. Aortic aneurysm, that's another one. And the next one is it could be upper motor neuron signs where your spinal cord is getting pinched. But you know what? That's where the medical doctors are. They can find out is there any red flag that we need to rule out, and they can order an MRI and CT scan. But if you don't have any of those big major problems, don't think your low back pain is coming from a disc degenerations or disc herniations and so forth. So take your mind away from that idea and look at the bigger picture. All right? One more thing I forgot to mention in the MRIs and a CT scan is there is so many studies out there, and I have put together at least 40 studies myself, and that's on the MRIs and CT scan done on the people without a back pain. Okay, no back pain whatsoever, and they have done the MRI on those people. Let me share one study with you just briefly. So this study was done on 66 people who their age was between 19 to 60 years of age, okay? But they had never had a back pain. So when they did MRIs on these people, what they found, 12 out of 66 people had a disc herniations and disc protrusion. The 26 out of 66 people had a disc bulge that was associated with the degenerative disc disease. They also found spinal stenosis, narrowed nerve root canals, and osteophytes, and multiple myelomas, and stuff like that. Most in all this 66 people, L5 and S1 was the most common segment that they saw the abnormality. So think that these people have never had a back pain, but their MRI shows same abnormality that you might have with your back pain. So don't blame your disc or any abnormalities, structural abnormalities for your pain. So I hope you really understand this what message I wanna pass on with these scans. All right, let's keep on going. Reason number 3 is the system of care. Now here is the thing, my goal and intention is not to point fingers at any medical professionals. I truly adore and love every single medical professionals out there. I think they are there in this field because they truly care for their patients, okay? So let's see what happens in the system of care. For example, you have had a back pain a few times in the past, and you went to a chiropractor and chiropractor manipulates you, you go a few visits, it gets better. A year later, pain comes back, and then pain comes back, and then you finally says, you know what, I think I need to go and see a doctor. Why my pain is keep coming back? And you go with the expectations to get more MRI, maybe MRI done, more thorough examinations done. You go with the very high expectations to find out why my pain is keep coming back. Now you go to your doctor and doctor evaluates you and they don't find any of those red flags as we talked about, like a fracture or a dislocations or infections or cancers or anything so forth. And they said, I think you need physical therapy, okay? And they give you pain medicines. Let's take this pain medicines for a month. Go and do physical therapy and see what happens. And that's it. That's how it goes. I have been there with the doctor myself, and that's what they do. And you know what insurance tells them? Don't order an MRI right away till they have not tried physical therapy. And sometimes the patients, they also tell the patients you have to do physical therapy before you go and get the MRI done. Now patients get pissed off. They want an MRI, but they have to check this physical therapy box off before they can get that done. So they come to physical therapy and are not expecting too much out of it in the first place. So the physical therapist will go through their assessment and we'll start with some exercises and stuff. And again, I said, what can be the problem with physical therapy with the chronic pain people? Yeah. Some people do get better with the improved blood circulations, increasing mobility and getting a core strength. They might see some improvement, but may not see 100% improvement. And it again depends on how the patient is actively participating in therapy. Okay, so after they have done 6-7 sessions, they don't get better. Then physical therapist says, okay, I think I'm going to send you back to the doctor. You didn't make any progress. So they come to the doctor again. Doctor said, okay, let's get an MRI done. You get your MRI done, and as we talked about earlier, MRI is going to show 1 or 2 or 3 problems, 3 different abnormalities. And now you're going to be fixated. Yes, I have this, and this wrong with me. And you and your doctor decides, you have some for example, your one vertebra has slipped on top of each other. Let's go and see an orthopedic surgeon. So you go and see this orthopedic surgeon. And orthopedic surgeon, again, they have to check their boxes off. They cannot just go and operate on you, okay? They said, well, you have not done injections. You have not done this or that. Let's go ahead and let's try some injections first. And you know what? The pain management doctor does a great job with injections. So they're gonna send you to a pain management physicians, okay? Now you come to their office, they'll do their assessment and they say, well, I can do cortisone injections, I can do nerve ablations, I can do this. And you and him decides on a best plan, what's gonna work the best. Let's say you decide on a cortisone injections, yeah? So you take a cortisone injections, and majority of the time when you have injections taken first time, it really works. It works for quite a few people. And you get pain relief for about 3 months maximum, maybe 2 months. So about 2 to 3 months, your pain goes away. And then pain eventually comes back. And then you said, okay, then you might have a follow-up coming up with the pain management. And then you try something else. Now by this time, you are about 6 months to 9 months from that original pain you started with. Yeah? You are still hopeful. There might be some hope. But eventually you have some fear build up over time. You don't do the exercise you were doing before. You are not that active like you before. You have more fear has built up and you have slowed down quite a bit. So you become weak. And then you have a significant weakness maybe on one muscles and the other. So then the pain management doctor says, well, let me send you to a neurologist. It's looked like something is going on. Let's get evaluated by a neurologist. So you come in a neurologist office and they do your evaluations. They might reorder your MRI again. And they say, well, I don't see any difference between the first MRI and second MRI. Let me send you to a PMNR, physical medicine and rehabilitation physicians, and they do a great job assessing where the problem is. So you come to physical medicine and rehabilitation physicians, yeah? So you sit in their office, they do their thorough evaluations and they say, well, you are weak here, and this is tight. Let's go and go back to physical therapy. And they will be able to help you out. Tell me, this is like a whole circle you run from one place to the other and you landed back in physical therapy again. Yes? This becomes frustrating, angry, you feel hopeless, and this is all doesn't help with your chronic pain. But here is the thing. Why don't we have the chronic pain specialist from the beginning? We have a pain psychologist. There are pain psychologists out there. And education was the #1 thing that was missing from the beginning. If that primary care physicians had a little more time to spend with you, rather than just 15 minutes, quick check-in and quick get out, if they had a little more time with you to sit down and educate you that what this pain is, this is a multiple factors plays a role or whatever, you might get best treatment outcome by doing this. Let me send you to a pain psychologist. Let me send you to a physical therapist who is specialized in a chronic pain. And that's how, once you have done that, this is it. You would have been cured in a much lesser time rather than going through a whole circle of care with a lot of frustrations and fear and some anger build up at the end. So I think the system needs to change for the chronic pain patients. Don't treat every chronic pain patient same as an acute care patients. They need a different kinds of a treatment and attentions from very beginning before it gets out of hand. Reason number 4, the long-term use of pain medicine. It is not common for me to come across somebody who has been taking their pain medicine for 2 months, 3 months, year, or 2 years. And whenever they go to a doctor, I do help out quite a few friends and family members, even out in the civilian world. I know I work with the veterans, and there is some stigma with the veterans that they can get the narcotics and opioids as much as they want. But this is even true in the civilian world. I do help out some people, and they will say, well, they have been taking, their doctor told them to take this medicine for about 2 months and maybe 3 months. They have, my husband had some pain, and he went to an urgent care, and he came home with the hydrocodone. I think it's a 1 month supply. He did not even need it, one single pill. But anyway, it's very, very common to get prescription, and without educating them that only take them for a very short time and just keep him on just in case if you need them. But some innocent people take them for a long time. But here is the problem. All those pain medicines, I do believe that all anti-inflammatory medicines can help you for first 2 weeks to 3 weeks. That's it. That to calm down the inflammation. But they are not needed. You don't want to keep on taking them for 2 years or a year or a long time. Because they only patch up, they only patch your pain. They are like a band-aid, okay? They don't cure your problem at all. So rather than, I would step back and see what is the source of the problem and fix it. Rather than taking this pain medicines for a long time will cause liver toxicity, kidney damage, stomach ulcers, addictions, dependence, and so forth. So why go into this big hole of problem when this thing's not going to help you in the long run? And I know people argue with me when I say that why you take pain medicine? And they say, well, at least I'm able to function. I'm able to get out of bed and do X, Y, and Z. And I know that's true. That gives you, maybe that just takes up a little edge of your pain and you're able to do things. But that's not, how long you're gonna go on and on like this, right? So please step away from taking that pain medicine and look at the bigger picture and think outside the box. Reason number 5, overuse of injections, nerve ablations, even surgeries, physical therapy, chiropractor, TENS unit, the list goes on and on and on. Same thing it drills down to. If you're not looking at the whole bigger picture for your pain and you keep shooting laser focused on your L5S1 and targeting those nerves and all that stuff, most likely you're not going to get any benefits out of it. Physical therapy, chiropractor, and all that do take care of part of the problem. They don't take care of the whole entire problems. So you do need to step back and look at the bigger picture rather than just fixing those structural abnormalities. All right, let's keep on going. So one more thing, that if you have not liked this video, please do so. So this can reach to many people who can really benefit from this chronic pain education. Reason number 6, fear avoidance education is described by your medical providers. And the many times that I come across people, they're so fearful to move. They say, well, I'm not supposed to bend over. And the medical professionals do advise them that don't sit for a long time. Make sure you stand up every 45 minutes. Don't stand for a too long time. Don't bend over. Don't pick up things heavy. And even I'm guilty of myself. I had a booklet, 35 to 40 page long booklet I made, and I was very proud of making this booklet, and had everything from A to Z. How to sleep properly, how to bend over and empty your dishwasher, shovel the snow, sit at the computer properly, and so forth. And you know what this does? This builds up the fear in your mind to the point that you are afraid to move. So don't let the fear sit in your driver's seat. Unconsciously, you come into this awareness that you don't want to do this, you don't want to do that, and we get programmed and become habitual of avoiding those things. And you know what those does? That makes you deconditioned, weak, and stiff, and builds up the stiffness in the body. So it does more harm than good. Our last reason number 7. Unconsciously, you're accepting the belief that you are a chronic pain sufferer. So let me start you with the story here. One time, I think about 6 months ago, my husband's cousin was coming to visit us, and my 10-year-old daughter asked me that, hey mom, who is coming today? And I said, do you remember the aunt we visited in India about 2 years ago? So she was about 8 at that time, and it was a late night visit, and she ordered pizza for us, and she said, oh yeah, is that the one she has a back pain? And in a few minutes, I'm like, this is very interesting that we did few things and she remembered this big fact that she is a back pain sufferer. And I remember that she mentioned she has three surgeries done in the past, and she was mentioning many times that how she can't do this, she can't do that, she has to be dependent on this person or that person because she has a back pain and she can't sleep in the bed. She says sleeps in the recliners, and I know that she was very focused on her back pain for that visit we had, and we were there at her house for about 2 hours, maybe 2.5 hours or so. But 8-year-old child remember and had just put that like a plug in that this is the aunt and who has a back pain. But you know what's the worst? That you yourself accept the fact that you are a chronic pain sufferer. And this is not, no matter what kind of a treatments you're gonna get, no matter what quality of the care you're gonna get, if you accept that fact that you are a chronic pain sufferer, you're not gonna get better. So don't let the chronic pain become your identity, okay? Change is challenging. It is hard, but you have to push through. You have to get out of this, that mindset you have been and come out of that. Don't accept the fact that you are a chronic pain sufferer. Just pull, the way I want to vision this out is get out of those bars of the prisons. Just no, I'm not accepting the fact that I'm a chronic pain sufferer. I can enjoy my life. I can do things. And that's your first key of success. And motivate yourself to make that change happen. All right, let's recap our all 7 reasons why the common medical treatments failed for chronic pain patients. Reason number 1, the treatments are misguided because of improper diagnosis. Reason number 2, majority of the treatments are focused on MRIs and CT scan. Reason number 3, system of care. Reason number 4, long-term use of pain medicines. Reason number 5, overuse of injections, nerve ablations, TANs, chiropractor, physical therapy, surgeries, and so forth. Reason number 6, fear avoidance education issued by your medical professionals. Reason number 7, accepting the fact that you are a chronic pain sufferer. I hope this was helpful and provided some insight to you. And you know what? Without taking actions, this education is not needed. So please watch my part 2 series and what are the alternative action plans you can take for lasting relief. One more thing, if you really think this video was helpful, please like, share, and subscribe my channel for oncoming educational videos, and also refer it to one person you know who can benefit from this particular educational video. I will be truly grateful for that. Thank you so much for watching, and thank you for your time.